Hello, my name is Clare Hofmeyr and I'm a research associate with Mothers to Mothers, an African-based health NGO that recruits, employs and trains women living with HIV as mentor mothers. My presentation is a multi-country review on reducing mother-to-child transmission among adolescent girls and young women in low and middle income countries. This study has been co-authored with my colleagues Agnes Ronan, Marjorie Mbule, Jude Egenbo and Catherine Schmitz. Despite high ART coverage in most countries in sub-Saharan Africa, adolescent girls and young women have lower uptake of treatment and experience inferior outcomes at many points along the prevention of mother-to-child transmission, or PMTCT cascade. For example, they are less likely to know their status before their first ANC visit, they have a poorer understanding of how to prevent mother-to-child transmission, and they tend to experience greater delays between diagnosis and treatment initiation. Given this, it is unsurprising that multiple studies have found that the odds of MTCT were 2 to 3 times higher among mothers aged 10 to 19 than among those aged 20 and older. Early and sustained utilization of PMTCT interventions is essential for success in bringing down the MTCT rate. This study contributes to the pool of research on the positive impact that peer support has in the fight to eliminate mother-to-child transmission of HIV among adolescent girls and young women across 6 sub-Saharan African countries. Working across 10 countries in sub-Saharan Africa, Mothers to Mothers employs, trains, and empowers HIV-positive women as lay healthcare workers. Our mentor mothers work in local communities and at understaffed health facilities to ensure that women and their families get the health advice and medication they need and to stay in care. As frontline health workers, they provide various services to bring pregnant women and new mothers into care and to keep them in care during the PMTCT period. These include household mapping for early identification, referral and linkage to services, active client follow-up for missed priority appointments, support in accessing infant prophylaxis and testing, and guidance in safer feeding methods. In our study, we conducted a retrospective analysis of a 36-month cohort of adolescent girls and young women supported by the M2M program. We used a cluster random sampling design to select 69 sites across Eswatini, Kenya, Lesotho, Malawi, South Africa, and Uganda. All pregnant women and new mothers who enrolled into the M2M program at these sites between the 1st of January and the 30th of June 2016 were included in our study. Data were collected for all interactions with a mentor mother from the time the client enrolled until the end of 2018. In total, the sample includes 2,462 women aged 10 to 24 years old at the time of enrollment with M2M. Our sample of pregnant women and new mothers had the following characteristics. 80% of the sample were young women aged 20 to 24 years old at the time of enrollment with M2M. The remaining 20% were 10 to 19 years old. Just over half of the sample enrolled during the antenatal phase, or in other words, while pregnant. Only a third of those who were pregnant at enrollment with M2M attended their first focused ANC visit at the clinic in their first trimester. Just over half attended in their second trimester, and 13% attended in their third trimester. 97% of the women in our sample were initiated onto lifelong ART, and among those, 90% were initiated during or before pregnancy. We find the following outcomes for infants along the PMTCT cascade. The vast majority of infants, 90%, received their first PCR test between the ages of 0 to 8 weeks old. Uptake of the final test at 18 to 24 months old was lower at 72%. Among all women delivering, we find a transmission rate of just 2%. If we restrict the sample to those infants where we know their status at 18 to 24 months, the transmission rate was 2.9%. The 95% confidence interval around both of these statistics falls below 5%, indicating that virtual elimination was achieved. Among infants who seroconverted, uptake of ART was high at 83%. Our findings show continued late entry to PMTCT services among adolescent girls and young women. This may suggest that this group does not engage with sexual and reproductive health services sufficiently or at all before pregnancy. However, once identified and linked to care, testing uptake, mother-to-child transmission, and uptake of ART among HIV-positive infants compare favorably with outcomes in Eastern and Southern Africa as a whole. For example, the UNAIDS Data 2019 report found that over all women aged 15 to 49, 68% of infants received the first test as compared to 90% in our sample, and the MTCT rate was 9% as compared to 3% in our sample. This may suggest the positive impact of the M2M peer-based model on MTCT outcomes in this group. To maximize PMTCT outcomes for adolescent girls and young women, there is an urgent need for innovative interventions that target this population group early to provide a supportive sexual and reproductive health environment for those who fall pregnant. M2M is currently piloting such a program in South Africa called HISP, High Intensity Interval Service Provision. In this program, youth facilitators and young mentor mothers deliver modular group education sessions to empower pregnant and breastfeeding adolescent girls and young women with information to enable them to make informed choices about their sexual and reproductive health, pregnancy care, and parenthood. Thank you very much.